Occupational hazards. After occupational hazard, we have sociological perspective. If we see from sociological perspective, certain theories that that backs these hazards, these problems, are environmental justice and global versus local perspective. Environmental justice say that everyone gets a fair right, everyone gets a fair distribution of environmental burdens, and no one has to carry the burden of other social class. Global and local perspective, and the impact of environmental factors on health can vary significantly from one region to another. Global policies can change from one place to another, but still there are policies informed by sociological research for addressing public needs. Public health intervention. Sociologists advocate for intervention that not only treat but also prevent issues and by modifying environmental factors. Next we have is interconnection between physical health. We know that when physical health, as Gen Z, we are certainly aware about when our physical health is affected, our mental health is also affected, and when our mental health is being disturbed, our physical health is also affected. Let's say we are suffering from mental health. For mental health, let's take an example. We are suffering from depression. What happens to you? Your gut is unstable. You feel anorexia, you don't eat things, you always feel tired, and these are the physical symptoms. While if you on the other hand, if you are physically unfit, like you for example, if you get amputate your leg or arm, what would you do? You would fell into anxiety, depression, constantly overwhelmed by inferiority complex and all these things. Your mental health is being disturbed. So both of these are greatly connected with another. Let's take a look. Physical health refers to the well-being of the body and proper functioning of bodily system. It is often assessed by measuring indicators such as fitness level, absence of disease, and overall body function. And mental health includes emotional, psychological, and social well-being, how individual acts, thinks, and feels. Now, the bidirectional relationship here is like this. Look at this: improve sleep, reduce stress, slow dementia and cognitive decline, lower risk of depression, self-esteem. These are both interlinked with another. Okay, chronic illness. Common condition highlighting interconnection here are chronic illness like arthritis, cancer, cardiovascular often coincide with depression. As we have already discussed about it, anxiety disorders can cause gastrointestinal issues such as irritable bowel syndrome, and stress and cardiovascular diseases. Interaction, how biological pathways interact. We are going to see that neurotransmitter, hormones, and the immune system are all involved in the bidirectional pathway. When a chronic illness causes inflammation, the neurotransmitter function is being affected, because neurotransmitters send signals. If the signals are not conducted, if the signals are not interpreted properly, our biological pathways of body is severely affected. Lifestyle factors involve our diet, exercise, and sleep. If we don't diet, exercise, and sleep on time, we know that our mental health, our mind gets tired of things, and we are anxious, always irritated. That's Poor lifestyle also causes mental issues. Social determinants, socioeconomic status, education, and social support significantly impact both physical and mental health. That is known to all. Integrated healthcare systems and lifestyle modification and stress management techniques, cognitive behavioral therapy, meditation, mindfulness can help manage stress. Thank you.